Hi everyone, Jim here from Village Local. Thanks for joining us for another session. And in today's conversation, I'm joined by Dr Ganesh Naidoo, who is the co-founder and CEO of an organization called MedMate. So welcome, Ganesh.
Thanks, Jim. Great to be here. And I know we had a really interesting discussion last week, so I'm really looking forward to being able to share that discussion with your members.
Yeah, so look, that's a good segue, right? So Ganesh and I were having a chat last week. I only met Ganesh last week. He runs an interesting organization. He's got an interesting background, and I'll let him elaborate on that further. But Ganesh and I sort of connected because he's producing some great information about staying well by using an innovative model of accessing your pharmaceuticals. And he was producing some great content, and one of my colleagues came across that content, and we wanted to share it with the community. And I was telling Ganesh last week about how the service that his organization provides, I wish I knew about it a few months ago when I was on the phone with a lady down in Melbourne. She was in the middle of lockdown in Melbourne. And this is a lady who suffers from anxiety, depression, is diabetic as well. And she hadn't left her home. She was telling me she hadn't left her home in about 2 weeks, right? So she was low on meds. She hadn't taken her meds in a few days. And when I asked her about, from a shopping standpoint, from a grocery standpoint, what's going on? What's your pantry look like? And she said, "Oh no, I'm fine for groceries. I've still got a few cans of spaghetti in the pantry." And I just thought to myself, wow, this is a really troubling situation. A lady who is surviving on a high salt, high sugar diet. For a diabetic, that's probably not the best thing. Plus the mental health challenges that she's living with as well. This social isolation is really causing her challenges. Had I known about an organization like Ganesh's back then, it would have been marvelous to connect it with. So with that in mind, Ganesh, why don't you tell us a little bit about what MedMate does and the sort of community challenges you're solving?
Yeah, thanks, Jim. And just to introduce myself, I'm a general practitioner. So I've worked all over Australia and helped lots of patients in many different circumstances. And the types of issues that you just described of people being socially isolated and not having easy access to manage their medications and their healthcare is actually fairly common. I used to work up in North Queensland in Cairns, and I used to look after patients all the way from Cairns up to Cape York, all the way to Thursday Island and Bamaga and Cullen. And patients used to come down and see me and have a consultation and then head back to the community. And I would try and manage their healthcare between consultations, and I had to do things like get people medications, so I had to get them a new script. I had to help people organise things like referrals to get a radiology test or pathology test. And what was really frustrating for me as a doctor was it was really hard to do that. It seems really simple, but when people are separated from you by distance, it's really hard. You have to fax pieces of paper around, you have to call pharmacies up and see whether they can deliver. And that's not a simple thing to organise. And so the concept formed with me many years ago that this needs to be a whole lot easier. People need to be able to access medications and access healthcare in a much simpler way because it's not easy for everyone to coordinate their care. And when you actually look at the research behind this, this is actually a significant problem for the country. Around 50% of patients who have a regular medication are actually not adherent. They don't actually take the medication as prescribed. And the main reasons around that are logistical issues. They find it difficult to coordinate the scripts. They find it difficult to get to the pharmacy on time. They forget, they run out of medicines. These are all very common problems. And our immediate thought was, you know what, we need to make this easier. We can order a pizza on Uber Eats by pushing a couple of buttons. Why can't we have our medicine delivered? What's more important? So that's how the concept of MedMate started, and we've been on a 2-year journey working with the Australian government around electronic prescriptions and medication delivery. And what we've done is enable patients to be able to have medications delivered to the home when they need them. So any patient in the country pretty much can now load a prescription onto the MedMate system, choose a local pharmacy that they want to have that order placed with, and organise that medication to be delivered within 60 minutes. And that's happening all over the country: Melbourne, Sydney, Brisbane, Perth, Adelaide, and it's really helping patients who have the kinds of access issues that you described with that customer, or with mental health issues and diabetes.
That's amazing. And you know what, like, you've been around for a couple of years, and I imagine that other organisations providing similar services in the community have been around for the same amount, or maybe a bit longer or a bit less. But it really baffles me, in today's day and age, considering you talk about Uber Eats and delivering pizzas, that such a community challenge has been so prevalent for so long. And we're only sort of turning the corner on being able to deliver this service to the community now. From your experience, your GP days, when you were sort of solely focused on that, what have been some of the detrimental effects that you've seen on the front line for those who haven't adhered to their medication purely because of logistical reasons?
Oh, there are all sorts of health issues which are exacerbated by not maintaining a regular medication supply and management, Jim. So I'll give you a great example. I was just talking to one of our customers yesterday in Melbourne who has placed a lot of orders with MedMate, and she provided a review for us, and I managed to have the call come through to me, and I had a chat to her, and I said, look, I'd just love to hear your story. And she actually has epilepsy, and she can't drive. And you may know with epilepsy, to stop yourself from having seizures, you need to maintain a regular medication supply. If you run out of your medicines and your levels drop, the likelihood of you having a seizure is very high. So this is someone that cannot run out of medicines. Now, she can't drive either. So the only way she's been able to get to a pharmacy is to take public transport. And she has to make multiple trips. And it takes her an hour each time by the time she gets from the door to the pharmacy and back again, just to get her meds. And she said, this has just been such a change in my life for me. Yeah. That I'm able to now, push a couple of buttons, have my medication arrive. I don't run out. I've been seizure free. It means that I've got more time in my life now to do other things. And I've been looking for this service for so long. So that's one very concrete example of how it helps someone's life. But I guess to answer your question in even more detail, Jim, every chronic medical condition, so people who have diabetes, people who have rheumatoid arthritis, people who have asthma, it's really, really important that they maintain the regular medication management regime. If you don't, you'll definitely have Western control. So for example, someone with diabetes, you're generally on medications which control blood sugar level, you're on medications which control blood pressure, and those medications need to be maintained. Otherwise, your sugar levels will not be at the adequate level, and you'll have damage to multiple organs in your body. So you have damage to your eyes, to your kidneys, to your heart. It can increase your risk of heart attack and stroke, increase your risk of having vascular disease and having a risk of an amputation. These are all insidious issues which, if they're not managed appropriately, you will have a life-changing complication. So the problem is, someone with diabetes on a day-to-day basis, with type 2 diabetes, doesn't have too many symptoms. So it's very easy to forget about your meds, it's very easy to run out, and we need to make it as simple as possible for people to have the medications that they need arrive at their doorstep, so they don't even have to think about that aspect. At least we know, hey, they've always got the medications. They've always got them there. They've always got them there to take. And then we're also trying to provide education to people to say, hey, you've got your meds now, but it's really important you learn about your disease, you learn about diabetes, you learn about the complications, and that allows people with that education to manage the disease more appropriately.
Brilliant. So it's really about a holistic sort of service offering, right? You've got the medication, but you've also got the ongoing engagement, education, awareness, contact to support somebody through their therapy, their pharmacological therapy anyway.
Jim, that's what we've really found, that when we started this journey, it was very much focused on the problem. Hey, let's get medications to people when they need them. But we found so many people asking us questions on our website through our chat service, or sending us emails and saying, hey, I've got rheumatoid arthritis. Is it safe for me to have the COVID vaccine? Oh, I'm on this medication for diabetes, but I want to take this vitamin. Is that safe? So we found we're answering lots of questions, and which I love to do. I love answering questions like that. So we decided, hey, we need to form a community here. Everyone's asking the same things. Let's have a regular newsletter where we provide answers to these questions. And hopefully that helps lots of people understand the disease a bit better.
You mentioned the newsletter there. You've got some other educational resources. At the end of this, guys, watch the end of this video. I'm going to share links. I'm going to let you know how to get in contact with Ganesh's team and look into the services that MedMate offers. So stay tuned. Let's talk a little bit about the nuts and bolts of getting access to your service or interacting with the service. Let's talk about, we'll call her Mrs. Smith down in Melbourne. Diabetes, depression, anxiety, social isolation. For a person like that, what are the steps that she needs to take today to start accessing or benefiting from MedMate?
I guess the way I think about this, there are two groups of patients. There are patients who are very used to using technology, very used to the mobile phone and use it all the time. And so for those patients, we essentially have a self-serve system. So you can log on to the website, medmate.com.au. From there, you can literally start placing an order. So all you need to do is put in your address. When you put in your address into the website, it'll show you a list of pharmacies in your area that can deliver to you. You can then click the shop online button and you essentially will shop that pharmacy's catalogue. So anything that pharmacy sells, from Panadol to Gastrolite to vitamins, to skincare products, you can purchase them for delivery. You can also upload your prescription. Now, the way you upload your prescription is you need to ask your doctor for an electronic prescription. This has been a big change that's been introduced by the government over the last few months. It was always on the cards, but it was fast-tracked because of the COVID pandemic. So what it is that everyone would be used to a traditional prescription, which is a piece of paper you get from your doctor. Usually it's a green piece of paper that a doctor prints out in their printer. You can still get that. You can always still ask a doctor for a piece of paper prescription. But now you can say, hey doc, instead of that paper prescription, can you give me an electronic prescription, please? And pretty much every doctor in the country can do that now. They just press a different button. And what happens is that script lands on your phone as an SMS or an email. And you just click the button and it opens up as a QR code. And everyone's probably used to QR codes now with COVID. It's just another QR code. And what you can do with that QR code is you could either walk into a pharmacy and get it scanned, and that's how they scan your script. Or like we were saying before, you can load it into the MedMate app and then choose your pharmacy, put that script into the cart as you check out and have it delivered. So it actually is fairly simple for someone to choose a pharmacy, add all their front of shop pharmacy products, add their rescripts, pay for it online and have it delivered in 60 minutes. That's the really simple way for someone to use MedMate. But not everyone's used to using websites and apps and those kinds of things. We understand that. There are a lot of people that, that's probably a little bit difficult for them to learn. So what we're developing now is a service, essentially a concierge service where you can contact our support team at support@medmate.com.au and we'll do it all for you. So we'll work with your local doctor. We'll make sure we get the right medication list so we know what medications you're on. We'll get your doctor to organise your scripts and send them to us. And then we'll manage your scripts. We'll set up a regular order fee. So if you want to say to us, you want your medications to arrive on the first Friday of every month, we'll book that time in. And every Friday, first Friday of that month, you will have your medications arrive on your doorstep. They can even be packed. So a lot of the issues that patients face, particularly when they get older, is actually managing the medication. So they come in different boxes and they come in different packs, and if you've got arthritis, it can be really difficult to push the blister pack open and you forget whether you've taken one or not. So it's often advisable if you have multiple meds to actually let us pack it for you. We can pack it into a Webster pack or a dose administration aid, which means that it's organised by day of the week. So you just know that on Monday morning, you press this pack and you take those tablets. On a Tuesday afternoon, you press this part of the pack and you take those tablets. We'll pack it get all your meds and scripts organised and get them delivered to your doorstep whenever you need them, essentially. And you don't have to do anything. You don't have to do anything with the website or with the phone. It's just a service that our customer service team organises for you behind the scenes.
I can imagine if you were the care recipient with multiple chronic illnesses on multiple types of medication, what you'd explained is amazing. But I can also see the benefits for, say, a family caregiver in caring for their elderly loved one or an elderly parent. The peace of mind, knowing that challenge associated with what medication at what time and the adherence of that is all solved.
I was just going to say, Jim, about that carer functionality. I think that's actually a really important point, that often we have families which have younger family members looking after their aging parents. And the medication management actually falls to that person. And that person may not actually be physically in the location where their parents are. The beauty about MedMate is you can organise the medication delivery no matter where you are in Australia. So you would just put in your family member's address, load the scripts on their behalf, set up the order and have it delivered. We actually had an interesting case last week where we had a patient in Adelaide and his sister was managing his medications for him. He was actually intellectually disabled and living independently. And she said, look, he's actually unwell and he really needs some medicines today. I can't get there. Can you please make sure his medicines arrive today? And so we were able to work out what his delivery location was, help her load the order into the MedMate app and get it delivered to him. And it solved the problem. And she was kind of, tearing her hair out, thinking, I've got a real problem here. How do I help him get the meds he needs today? And it was actually fairly simple for her using the MedMate app. So I think there are a lot of people who are caring for elderly parents who are going to find this really reassuring, knowing that they can essentially take over the management just by using the app.
Yeah, that we call them the sandwich generation, right? Where they're getting squashed in the middle, looking after their elderly parents, looking after children, grandchildren, maybe even keeping down a job, keeping the household together. Any little logistical or time-saving opportunities is going to be a big one. So it seems like you're providing a lot of value to the community here. This additional value above and beyond what a local pharmacist is providing the community. Are there any additional costs or service fees associated for engaging the MedMate organisation?
So essentially, we work with local pharmacies. So any local pharmacy in the country is able to offer themselves on the MedMate platform and have their shop and catalogue online. What happens, they will load their catalogue. So whatever prices the pharmacy wants to charge is actually up to the pharmacy. It's not dictated by us in any way. In terms of delivery costs are actually set by the pharmacy as well. It really depends how quickly you need the medications. If you need the medications quickly, if you need them within an hour and it's after hours, for example, on a Sunday night, yes, you may pay a higher delivery fee for that. But if you just need your delivery, say once a month or something that's planned, it actually is fairly affordable. The delivery fee, I think we've got online at the moment, about $5 for a delivery of that kind. So, which is very reasonable when you think about how much it would have cost someone in time and fuel and effort to go and pick it up anyway. So it actually works out, fairly well. So that's really the main costs associated with the on-demand service. With the concierge service, we're actually launching that at the moment. We're working on what the pricing is going to be, but we're trying to get it down to a level which makes sense in terms of having the medication packed and having it delivered to your home. We think it's going to be around $15 a month to have that service and the medications arrived at your doorstep.
Great. You mentioned it earlier, right? So thinking about the additional value it's providing, not so much just from the little logistical nuts and bolts, getting in a car, driving, getting on a train, whatever, but the longer term adverse events or effects of not adhering to medications. The costs, both measurable and not measurable, you can make your own judgment as to whether a service like yours or MedMate's would be suitable for you. Dr. Ganesh, thank you so much for sharing your wisdom. Thank you so much for the work you're doing in building this this great organisation, to you and your team. Keep doing the great work, and I'm glad we serendipitously crossed paths last week. You know, we are recording this on the 29th of June at 10:30 a.m., which is 3 days into Sydney's lockdown, or 2 days into it. I can't remember. It's all a twilight zone.
Yeah.
So very, very timely information for those in the community who are concerned about you know, medication management during this difficult time. Please reach out, whether it be contacting MedMate directly or contacting Village Local to help you find your way to MedMate or organisations like MedMate. The takeaway point is, don't suffer in silence. Reach out, there's support available. Okay. I'm going to add the link to this video. If you've got any questions, please reach out. Thank you again, Dr. Ganesh. Appreciate it.
Thanks, Jim. Pleasure to see everyone.
See ya. Bye-bye.